Hi, I'm Katie, and in this section, I want to talk about dry sockets and how we treat it. For the purpose of this discussion, we will define dry socket as a condition where there are no problems with the extraction sites other than the fact that there is discomfort. In order for us to diagnose whether or not you have dry socket, we need to first eliminate some of the other misinformation that goes along with the subject of dry sockets in general. First, we want to make sure that you know what to expect after your surgery. We want to make sure that you know it's normal for the discomfort and swelling to get worse on day 2 and day 3, and that the discomfort should then stabilize on day 4. It should start to get better by the end of day 5 or the beginning of day 6. Second, we want to eliminate the causes of discomfort, which would be things like food getting stuck in an extraction site, and most importantly, smoking. Third, we want to strongly emphasize that patients who smoke before surgery, or even worse during the days after surgery, often have pain that cannot be controlled with pain medication. This is not a sign of any problem. It's just a side effect of smoking. Once we have eliminated and reduced the possible reasons for discomfort, which could be the food or the smoking, and reviewed the normal expectations for discomfort after your surgery, we want to make sure that you're taking the appropriate amount of pain medicine. So to review, if you are having discomfort following surgery, but it's controlled by the correct dosage of pain medicine, then it is not discomfort caused by dry socket. And after surgery, if you have discomfort from food stuck in the holes where your teeth were removed, then we would diagnose that as dry socket pain and treat it appropriately. If you have a dry socket, we would have you come back to your dentist's office. We'll place a medicated dressing into the wound to reduce the pain to a tolerable level for a day or 2. At that point, the discomfort should be controllable just by using the pain medicine and avoiding re-injury or irritation from smoking, food, or vigorous mouth activity. It's important to remember that there are no long-term side effects from having dry sockets. The discomfort can sometimes be significant, but it is not a sign of poor healing or some other problem. It is only a delay in the body's healing response, which will correct itself in a few days.